deploy the Australian Medical Assistance Teams, or AUSMAT, and his advice to me was one word: ready. So his message is very clear. They are prepared. They were put on contingency earlier on. They've secured the medical personnel and they are prepared to deploy to Christmas Island, and they are forward deploying today. The administrator of Christmas Island, Natasha Griggs, was visiting and briefing the centre in Darwin. She knows both Christmas Island and obviously the centre very well, and so I've spoken also with Natasha Griggs, and they are prepared as well. So I've got to say that this is an extraordinary national asset, and so what we have done is brought into being what the World Health Organisation identified as one of the world's most prepared systems for epidemic. We have the National Incident Room, which has been established, the National Medical Stockpile, which is available and from which masks are being deployed. We have the National Trauma Centre, which runs the AUSMAT medical teams, and they are being deployed, as well as the consular crisis process, as well as the state and territory hospital and pathology systems. And I do want to acknowledge that the VIDRO, the Infectious Diseases Reference Laboratory in Victoria, as part of the Doherty Institute, has achieved something extraordinary, and Paul, I might ask you to add a little bit more on that, overnight with the replication of the coronavirus. That's of immense importance. I spoke with both the director and the deputy director, Mike Catton, who leads the team there overnight, and what this means is that Australia is helping the world with faster testing, with potentially better treatment, and potentially earlier development of a vaccine. And they are important, huge steps, not just for Australia and protecting Australian patients, but globally. Paul?
Thank you, Minister. So, as the Minister has mentioned, we are very well prepared. I'm in virtually constant communication with my state and territory colleagues. And we're having meetings virtually daily, and then a lot of other emails and phone calls. And so, as the Minister said, there's been 6,000 cases. Almost all of those have been in China, but there's about 100 internationally now over a range of countries, including Australia. We have 7 cases here in 3 states. And so we are taking the measures that are appropriate to protect the Australian public, as well as the Minister has mentioned, this plan to assist those that are in Hubei at the moment, or in Wuhan city, in relation to getting back to Australia. There's one thing that I do want to stress. After yesterday's announcement about we are now sure that there is possibility that people can transmit this virus before they become symptomatic. So this is quite a change in what we understand about the virus. And it has led to some different ways that we're dealing with the public health issues. But I do want to reassure the Australian public this is a very precautionary measure, and when we're talking about those that have been in contact with people with a diagnosis of the coronavirus infection, or who have been in the last 14 days in Hubei province, this is not just casual contact. This is someone that's been very close to someone who has the illness or who develops the illness later. For example, we've had inquiries today about receiving parcels from China. That's totally safe. The virus does not last on a parcel coming from China. In terms of walking past people in the street who may or may not be infected, that is also virtually totally safe. When we're talking about contact, we're really talking about close contact for over a period of time. And so I think that's an important message that people should take on board today.
Great. Happy to take any questions. So.
In terms of the evacuees, can you confirm that they won't have to pay for any medical or operational costs?
The Foreign Minister and DFAT are taking care of that, and the position that was that there would be some contribution towards the assisted departure, but the accommodation and quarantine is a matter for the government to absorb.
Okay. In terms of the health preparations on Christmas Island, how many personnel are being sent there? What kind of facilities are prepared?
AUSMAT is the Australian Medical Assistance Teams. Len Nataris is putting that together. He'll be providing a briefing later today on that. He has secured a significant number of medical personnel, so I'll leave that to him because it's operational. For example, they have recently deployed teams to the measles outbreak in Samoa. So they are set up as one of the world's premier organisations for rapid deployment to high contagion areas. And in fact, measles, and Paul will be better placed than me, is a far more contagious condition than, as we understand, this novel coronavirus to be. So they have not only the personnel, but they also have negative pressure facilities that they can take with them, and so they have intensive care facilities, so they are a mobile unit which can be dropped into any part of the world. In this case, they will be taken to Christmas Island.
The AMA has denounced the idea of taking
the
AMA has denounced the idea of taking evacuees to Christmas Island, saying it's very harsh. What's your response to that?
Look, I respect the views. I understand that there's full support for the quarantine processes, and then as to the logistics, ultimately the government, as a matter of national security, has to make that call as to where. And I'm not aware that any state has offered to clear out a hospital. All states and territories, and I think, Paul, you were part of this call yesterday, unanimously supported the quarantine procedures, given the additional medical advice which came overnight before yesterday's meeting from the WHO, and in particular out of Germany. So they were supportive of quarantine. We're not aware that any state or territory has offered to clear out a hospital for 600 people. So against that, our job is to protect Australian citizens as well as to provide support for those citizens overseas. And the best way we can do that is to find a place which was designed to deal with people who were coming from overseas in circumstances, and to do that in a way which is humane. This is a humanitarian mission, but no state or territory, to the best of my knowledge, has offered to clear out any of their hospitals. And in that circumstance, this is the right thing to do. It's the most appropriate thing. It protects Australians at home, but it provides a pathway home for those Australians who are in Hubei.
So why have other people been advised that they should self-isolate, and yet this group of evacuees has to be isolated on Christmas Island?
Well, it's the same period of isolation for the same group. They are coming from the heart of Hubei. They are coming as a group which has been in close contact with each other, and therefore we have followed the medical advice. This was a process of medical advice to the National Security Committee of Cabinet yesterday.
Mr Hunt, Peter Dutton said anyone evacuated to Christmas Island who becomes sick has the option to go to Australian hospitals if needed, and he said possibly Darwin. Can I have a more detailed on this approach? Or more detailed?
So I think that I'll refer to the medical care. As to other elements, Home Affairs is running that operation, so I wouldn't want to step inside that. But in terms of medical care, that if somebody became sufficiently ill that a transfer were required, we would do that immediately.
Okay. There are reports there are 2 Australians in China who are ill. Is that correct in your understanding? Will they be brought back to mainland Australia?
So my advice before coming to this event from the National Incident Centre in our morning briefing is that 2 Australians did contract the virus in Guangdong province. They have been treated, and the advice that I have, and I would want to be cautious on this, is that they have been released and are not seeking consular assistance at this stage.
On masks, logistically, how will the government be getting these masks to doctors?
So masks, as was announced yesterday, masks would be provided to the primary health networks, and the primary health networks would assist in the distribution to those general practices that wish to receive them. I've asked to make sure that I have an update on the distribution process today from each of the 31 primary health networks. Paul, did you want to add anything?
So just to say, these masks are coming from the National Medical Stockpile. They will be going to each and every of the 31 PHNs. We are looking to prioritise Victoria and New South Wales because of the fact that they've been somewhat overrun by the bushfires in recent weeks, and a lot of mass distribution there. But every PHM will get them. That's logistically getting these masks out to the whole of Australia, and so that will start today.
So how will that happen? Postage, courier, drop-off? How's the distribution going to happen?
So under the arrangements for the National Medical Stockpile, we do have a contract with Toll, and they are responsible for the logistics of moving anything from the medical stockpile, in this case masks.
So they've been commissioned. They're in distribution mode. In fact, I visited one of the National Medical Stockpile sites in Melbourne last Thursday to examine exactly for this preparedness. One of the things that Australia has, I mentioned the National Incident Centre, the National Trauma Centre, which oversees AUSMAT, the National Medical Stockpile, as well as the consular crisis process within DFAT, and then the emergency management processes with the states and the experts through the state hospitals and state pathology services, is a system which was developed for this moment in history. And what the Prime Minister has been doing through the National Security Committee, it met yesterday, he's announced that it will meet tomorrow, met earlier on in the week on Monday, is making sure that all those elements that need to be implemented are being implemented, and those which may need to be used in the future are ready to be used. And I think that's the preparedness which is important for the Australian public to understand.
Minister, the World Health Organisation has advised against evacuation from China. Why is Australia going against?
Well, we're following the Australian medical advice, which, by the way, is consistent with the practice of other countries such as the United States and Japan. And I note that some would be very critical if we were not to do what like-minded countries were to do, and some may take a different view. What we're doing is following the medical advice that not just Professor Murphy and Professor Kelly have provided, but the unanimous advice of all of the state and territory chief health officers in conjunction with the Australian ones. And again, that itself followed the expert advisory panel which the Chief Medical Officer convened yesterday, which brought together communicable and infectious diseases experts. So, of any country in the World Health Organisation 2 years ago, when they did the review of Australia's epidemic preparedness, identified us as being at the absolute global forefront.
Would you please give us an update on the timeline for this evacuation from China?
I'll respectfully leave that to the Minister for Foreign Affairs. I know that they're working around the clock.
Do you trust that China is telling the truth about the epidemic?
Look, we have had constant briefings from China. We can only go on the information we have. I do know that the WHO has, in the last 24 hours, been very praising of the information that they've received. They're in a better position than myself to judge.
Minister, if someone has been in contact with someone on Christmas Island who becomes sick, does the period where, like the 14-day period, start again?
So for...
will they stay on Christmas Island longer if they've been in contact with someone who becomes sick?
Okay, so if you talk about contact, and then I'll listen.
Thank you. So in terms of context, the 14-day rule is based on what we know so far about the virus in terms of the incubation period and the infectiousness. And so that's where we come up with the 14 days. And just to say, we do know a lot about this virus very quickly. So we've only known that there was a viral outbreak in China just over a month ago, and already, as the Minister has said, we have the virus, we have the full genetic sequence, we have a test, and so we can make very rapid assessments about someone who becomes sick, whether they actually have this novel coronavirus. The people that are coming from China, they won't be travelling if they are sick. They'll only be travelling if they have no symptoms. It is a possibility that those that end up at Christmas Island may well develop this disease, but there will be processes in place to make sure that they are protected from that, and if they were to develop the disease, they'll be treated accordingly.
And would the people that have been in contact with them have to stay longer on the island?
So I'm sure that there will be procedures put in place so that contact is minimised, and so that is unlikely to be a problem.
In terms of transmission, do we know anything more about the major form of transmission for the virus at this stage, or is that still a bit unclear?
No, it's quite clear. We know quite a lot about coronaviruses. This is a new coronavirus, but there are many of them that infect both animals and a few in humans. This is quite a different one to the ones that we know quite well. SARS from 2002, 2003, and MERS more recently are very different viruses in terms of how infectious they are. They're much less infectious, and they are probably more dangerous than the one we have now. This is quite a virus that seems to be able to be transmitted from person to person more easily than the previous ones. But as we start to see more and more cases with mild illness, I'm more confident that we will see that the serious end of the disease is actually the minimum. In terms of its transmission, it's transmitted by droplet. That's very similar to the way that influenza and cold viruses are transmitted.
Could you just explain the difference between droplet and airborne?
Yeah, so it's a somewhat scientific epidemiological difference, but it's an important one in terms of the way we deal with public health threats. So this is a droplet spread. It actually relates to my previous comment about parcels. People that sneeze or cough, the virus particles can go onto surfaces. They rapidly die. They don't get transmitted over a long distance. It's quite different from measles, for example. Measles is much more infectious. On average, a person with measles will infect another 12 or 18 people if there's no vaccine. So this can be rapidly infectious, as we saw most recently in Samoa for people that are not protected. Whereas for the droplet infection, it tends to be between 1 and 2 extra people, which is still a concern. That means it will continue to increase over a period, but it's definitely not as transmissible or as dangerous as measles, for example.